let's continue with part 2 with our discussion. And Dr. Cousens, you made a great point. You said, I think we all at this point understand the problems, and maybe let's talk somewhat about the solution. But before we do that, I think that today's lectures by Robert Whitaker and Irving Kirsch really went into detail on the specific classification of drugs, of antidepressants, and what's it actually called? Is it antidepressants, or is it also antipsychotics, or antidepressants? So when you say antidepressants, the antipsychotics and anti-anxiety is not part of that?
No.
Or is it the same thing? Different class. Okay. So we talked about antidepressants. But for those of us here who hear this and hear all the problems with making decisions about drugs, is there anything you want to say about other drugs that you're as clear on? In other words, there are statin drugs, there are other types of drugs. Are there other drugs that you have as much clarity that you could say with certainty that we should be very, very careful and conscious aside from just antidepressants?
Well, I'd like to address that one because I also sold statin drugs. And I sold one of the older statin drugs, and when the current market leader came out, we were very concerned as a field reps. You know, we were in our meeting and we're like, oh my goodness, this drug lowers cholesterol up to 47%. How are we supposed to sell this dog drug that we have now? Because usually when a new drug comes onto the market, physicians are very quick to adapt prescribing the new drug because there's lots of marketing hoopla that goes with, you know, the launch of the product. And so we were all concerned about our market shares because that's the way that reps get paid bonus money. And so, again, that was one of the times I learned that we had friends in the FDA because I was told, well, the district manager said, you guys don't need to worry about this. We have an approach how we're going to combat this because, you know, this new drug could be problematic. And we're like, problematic in what way? Well, you know, you can lower cholesterol too much, and because cholesterol is the most common organic molecule in the entire body and brain, you can wreak havoc in all the other body systems if you lower cholesterol too much. And so I'm thinking to myself, well, I've learned that all individuals respond differently to these drugs. How do we know what is too much for an individual with any drug? And, you know, he's like, well, we really don't know that. We just know that. And he starts educating me, and they bring this marketing perspective in. This is how we combat the competition. And they start telling us all this negative information about the damage that statins do. And this is the first time in 3 years I've heard about it. So I'm like, oh, wow. So now I realize that, you know, these drugs maybe aren't the cure-all, be-all, end-all for the treatment of MI because it's actually, cholesterol is a risk factor. It's not even a disease. And so when they really started giving me the true, fair, balanced information that they were saying that we were supposed to be presenting to physicians, I realized that the statin drugs were indeed a very problematic category of drugs. But then the other thing that I was told was that you don't need to worry about that because you know what you do if you want more pie. And that's like, no. It's like if you want a bigger piece of the pie. And I said, no, what do? You bake a bigger pie. So our friends in the FDA, we found that if you lower LDL below 100, that there's fewer heart attacks. And so we're having the clinical standards revised. So overnight, they tripled the population of patients that were available for statin drugs.
I have a little bit different experience about statins. Diabetes is a particular area of interest for me, and the research is showing that statins increase your rate of getting diabetes from somewhere, depending on the research, between 48 and 80%. And obviously that means raising your blood sugar. Now, the thing that's interesting is a little bit about what we're talking about with the psychiatric drugs. When we talk about manic depressant for 2-year-olds, is that what are we talking about? Really manic depressive for 2 years? Or are we just talking about fairly normal kids being kind of on the edge and being diagnosed that way? So we're creating a disease that doesn't exist. And then we'll treat it pharmacologically. So the research over the last 30 years on the whole thing on cholesterol has shown one very clear thing, as it was published in the Archives of Internal Medicine, pretty major journal, in 2009, which is both random studies and cohort studies. None have shown any association between your cholesterol levels and heart disease and heart attacks. That's 30 years of studies. Now, the whole statin thing has been created for a world that doesn't exist. It's like a fantasy world that's been created that we're treating a problem that isn't a problem. Mm-hmm. And it's a pretty big seller. Now, there are some problems with statins, right? Besides the diabetes, they increase their rates of stroke and Parkinson's disease and cognitive decline, muscle aches and pains.
Cancer.
And there are lots of lists, but I think it's interesting the amount of lives saved by statins equal the amount of lives of people who die by taking statins. Kind of break even. So it's like a total mythology that's been created for a disease that doesn't exist in relationship to the cholesterol. It's really interesting. In fact, women with a cholesterol of 270 and higher live 28% longer, 270 I said, right? I didn't say 170, 270, than women with a cholesterol of 193 or less. So the data, you know, this is pretty significant. That was a study of 52,000 people in Norway. So what are we going to say as we start to look at, again, creating myths, basically lies about what you need to take care of yourself, you know, when there's no connection. So we have a lot of problems with a lot of the drugs. It's creating a use for something that doesn't really exist. So it's pretty significant, and a lot of harm that comes out of that.
Dr. Cousens, let's go off topic just for one quick second, so there's no confusion. You're saying that the higher levels of cholesterol are not concerning you, but on the other hand, you're not recommending people eat animal products that raise their cholesterol. So just to
no, you don't want to go out of your way to raise your cholesterol. And really, we have to understand that 80% of the cholesterol our own body makes. Mm-hmm. Okay, and what I found in my diabetic study of 120 people is that we really drop the naturally eating a healthy way. We drop it naturally drops to about 159, 160, which is a decent and safe level. No, I'm not suggesting we go for cholesterol, but people's physiology is different. There's people eating the same diet and it can be, you know, 260, and the people eating the same diet and it could be 160. There are variations because we're unique, so we don't want to make pathology out of what isn't pathology. That's what I'm saying.
Okay. So to go further with the same question I just asked, if we've talked about antidepressants and we've talked about statins, there's a whole list of other drugs. I don't know anything about them. Sometimes my dad's on like 12 different drugs. My mom's on a bunch of drugs. A lot of people I know are on drugs. I don't know anything about them. But so far what we've discussed was very discouraging in terms of feeling confident that these have been, that we have all the information on them. So is there anything to say about any other categories of drugs that we know of?
Well, the thing that really needs to be said is as we move out of the paradigm, better living through chemistry, and we move towards the paradigm, better living through better living, a lot of the problems that people have can really be healed in a way that uplifts people with no side effects. Take high blood pressure. That's very easily treated in natural ways. I'm not going to get into the ways. Take depression. Can any antidepressant talk about a 90% success rate? No. So our answer to a certain way is that there are natural ways to naturally heal people without all the downsides. And what's interesting is they're all the better for it because they've uplifted their quality of life and are more living a full life on all levels, physical, emotional, mental, and spiritually. That's a value. So when we go away from drugs, we start to move towards an evolutionary way of being. So that, in a way, is a way of getting people, let's say, more interested. But to do that, and this is one of the problems, you have to love yourself enough to want to heal yourself. Mm-hmm. Fundamental. And what we see in America, and America is the biggest drug user in the world. Mm-hmm. Over 70% of Americans are using some pharmaceutical. That's a lot, okay? And it's like, oh my goodness. Teenagers over 12 in the teen range are taking an average of 1.2 brain-altering medications. That's every single teenager in the country. I mean, not every single teenager is taking drugs, but when you look at the picture, it averages out that. So these are horrendous type of statistics. More drugs in the United States than anywhere in the world. Okay, and what are we talking about meaning and value of life? So what we do have some answers to is, or let's say questions is, what is your life about? What are you here on the planet for? And beginning to promote health, well-being, and consciousness as an approach. Now, one of the things we talk about with the antidepressants, the SSRIs in specific, is they create a subtle, I'm going to use the term lobotomy, okay? That when we look at the big crimes that have been done with teenagers killing people in the schools, the majority, the vast majority of those kids are on antidepressants. So I don't want to go through every single one, but the point is pretty much every one. Now what's going on? So these are people that through the drugs have been alienated, then they've got this akathisia that pushes them towards 3 times more suicide and homicide. What's happening for people? Have we lost our connection with what life is about? And that's what we're seeing. So instead of seeing life as an evolutionary thing, it's like take a drug and go numb. And that affects our way we relate to people, it relates intimacy, the whole society in many serious ways is breaking down. So these are some of the issues that the drugs are both a cause and a reflection of. So I'm raising the questions on a kind of much bigger level. This is a national and international disaster, the way this is going. And maybe the drug companies, maybe they want to make their profit and all that, but it's out of hand. The ethics have gotten lost along the way, and the purpose of life gets lost too. So this is really what the whole world faces. U.S. is a great leader in this. It's #1 in drug taking. So these are the questions I'm raising, is like, how do we look at this? How do we turn this around? How do we change the value system that says you're put on the planet to grow spiritually, to have meaning and value? These are things that are being forgotten. And the result is intimacy is breaking down. There's like, well, since the 1960s, you're talking double the amount of divorce and triple the amount of suicide among teens, triple the amount of suicide among teens, okay? 4 times more violence, 5 times more people in jail, 10 times more depression than the 1960s. So what is going on? So we need to look at it with a more global perspective. And drugs are taking us way away from any kind of awake global perspective.
Again, on a side note, is it a great concern that people are peeing pharmaceutical drugs into our water systems? Is this a significant concern that's getting into our drinking water? And
it's not a problem if you have a good water filter, I guess.
Okay.
then again, what are the animals eating? What are the cows having, you know, in their milk? It's like, it's a huge problem. Yeah. And the fish in the rivers are having all kinds of abnormalities based on these hormonal abnormalities. It's not a humorous side effect, but it's a very important side effect because it's affecting our whole ecology.
My father lives in Las Vegas, and he recently sent an article to me to show me that the fish in Lake Mead are no longer reproducing because they're now asexual. They can't reproduce, so they have to restock Lake Mead all the time, and it's because of all of the pharmaceuticals and the antidepressants and the birth control pills that are found in the water when they test it.
You may or may not know that the antidepressants drop your libido somewhere between 30 and 60%. So that may be happening with the fish too, I don't know.